Hello, my name is Dara Shin, and I will present on the association between sugar-sweetened beverage consumption and body mass index in New York State. Obesity is the second leading cause of preventable death in the United States. Unfortunately, obesity has reached epidemic levels in New York State, where a quarter of adults are obese and another 35.9% are overweight. This affects an estimated 8.7 million people in the state of New York. In New York City, more than 58% of the adult population is overweight or obese, and obesity has risen from 18% to 24% between 2002 and 2012. The purpose of this data analysis is to assess the association of body mass index, or BMI, and sugar-sweetened beverage, SSB, consumption to suggest possible interventions to decrease the obesity rate in the state of New York. The Behavioral Risk Factor Surveillance System, or BRFSS, which is a network of health-related telephone surveys, was used in the study. The telephone surveys were conducted by all 50 states along with other U.S. territories. Technical assistance was received from the CDC in order to tabulate this data. The data file used in this analysis was a 2016 BRFSS, and only New York State data was used in this study. Stata version 15 was used to tabulate all calculations. There were several demographic variables used as covariates in this analysis because they posed to be confounders that can also affect the BMI. Covariates that are analyzed in this study included sugar-sweetened beverage consumption per week, sex, age, whether or not they're Hispanic ethnicity, race, which includes white, black, and other, education level, income level, physical activity in the last 30 days, history of cardiovascular disease, whether or not they were ever diagnosed with diabetes. Data cleaning was used in order to prepare the data for analysis in order to limit errors that may surface from potential confounding variables and from missing or incomplete data. For instance, in this analysis, categorical data that included responses such as don't know, refused, or missing were not included in this analysis. Certain variables had to be recoded to include a conglomerate of categories. For instance, in order to categorize subjects as having ever been told that they have cardiovascular disease, 3 variables including ever told they had a heart attack, ever told they had heart disease, and ever told they had stroke were all combined. Complex survey weighting was used in order to help the data set be more generalizable or more nationally representative. This is done when a small portion of the study sample is used in a study. This process reduces bias and can arise from using a very small sample frame by oversampling small subgroups and then applying a weighting variable in the analysis to all participants based on their membership in different groups. Linear regression was done in order to find an association between SSB consumption and BMI. Both crude association was done in order to view how BMIs regressed on SSB consumption alone, and adjusted association was done in which BMIs regressed on SSB consumption alone with other potential confounders. With data cleaning, it is important to adjust for confounding variables in the multiple linear regression in order to truly see the relationship between BMI and SSB consumption. The SSB consumption was also recoded to include number of SSB consumed weekly instead of daily and monthly. For results, this. Table 1 shows that certain baseline characteristics of the subjects, regardless of their BMI category, normal, overweight, and obese, were homogeneous. For instance, 50% of the overall sample were male. The mean age across all BMI categories was 45 to 50 years of age. However, certain baseline characteristics between the BMI categories were strikingly different. For instance, the percent of Hispanic representation increased with increased BMI. The degree of education was lower with increasing BMI, and the level of income decreased with increased BMI category. The degree of physical activity is lower with increased BMI category. Lastly, the history of CVD increased with increased BMI category. In this observational cross-sectional study, there seemed to be a positive correlation of 0.43 between the number of SSB consumption per week and the BMI, with the 95% interval being 0.05 to 0.81 and a p-value of 0.025 for the unadjusted linear regression. For the adjusted linear regression, there is still a positive correlation between SSB consumption and BMI at 0.47, with a p-value of 0.02. There seems to be a negative correlation of people who are not Hispanic and BMI at 0.54 with a p-value of 0.01. There is also a negative correlation of negative 0.82 of education and BMI with a p-value of below 0.001. This is very significant. There is also a positive correlation between answering no for any physical activity in the last 30 days and BMI at 0.73, which is pretty significant at p-value below 0.001. Lastly, there's a very strong correlation of 2.4 between being diagnosed with diabetes with a p-value of less than 0.001. So conclusion. Overall, the data suggests that there is a strong correlation between SSB consumption and BMI. There is also a strong positive correlation between answering no for physical activity and BMI. Lastly, there is a strong positive correlation between being diagnosed with diabetes and BMI. Because only the residents in the state of New York were included in this analysis, the results of the study cannot be generalized to all U.S. citizens. Another limitation of this data set is the lack of dietary data, such as the amount of vegetable consumption. According to the socio-ecological model, action must take place across multiple levels of the model, because one level begets the next level. Interventions that have already been done in New York have acted upon the community and societal levels of the socio-ecological model. Action has been done on the community level by increasing the availability of supermarkets with fruits and vegetables and fitness facilities. In fact, a cross-sectional study done on 13,102 adult residents of New York City found that access to healthy food stores associated with lower BMI and lower prevalence of obesity. Availability of healthier food options is needed because otherwise residents will seek food from fast food outlets and snack and beverage vendors. Education is also a very important intervention at the community level. For instance, school programs have worked to reduce childhood and hence adult obesity by educating children on healthy eating and lifestyle habits. Currently, 32% of public school students in New York State aged 6 to 12 years are overweight or obese. However, 40% of New York City public school students are overweight or obese. Change in the societal level by changing policies and laws are also necessary to decrease the consumption of SSBs. In one study, weight loss models were used to estimate the effects of a SSB tax on weight and obesity in New York City. Adults who consume SSBs in New York City derive 193 calories per day, or 10.6% of their total caloric intake from SSBs. The calorie reductions resulting from this tax may yield a consistent but non-significant decrease in obesity prevalence in New York City adult population. I propose a social marketing intervention to target residents within New York City. This will act upon the community level of the socio-ecological model. Because New York City has a large population, a cross-sectional study is most appropriate to assess the impact of a public health campaign. The goal of this intervention is to educate the New York City population regarding obesity and ways to prevent weight gain. Cross-sectional study before and after launching a public health mass media campaign will be done. Information about what causes obesity and its complications, as well as ways to adopt a healthy lifestyle, will be included in this campaign. Information will be broadcasted through the internet, radio, printed material, and television. Telephone surveys will be conducted in the community before and after the 6-month campaign to assess awareness of the campaign and its message on obesity. Attitude towards the prevention of weight gain and obesity will be assessed during the telephone surveys as well. Successful results from this social media campaign can then lead to a public health campaign for the entire state of New York. In this way, residents of New York State will be educated on the health risks of obesity and how to adopt healthy lifestyle changes that can prevent weight gain. Here are my references. If you have any questions, please feel free to ask. Thank you for your time.